Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV Health Program. Today we have Dr. John Bilezikian with us. He's professor of internal medicine and pharmacology at Columbia University. And Dr. Bilezikian and I, we're going to talk about the cruise medical program, as well as some programs that he'll be talking about in Armenia. And the next program we'll be talking about with him about osteoporosis. Dr. Bilezikian, welcome to our program.
Thank you very much.
Program.
Yeah,
this Armenian Cruise, Heritage Cruise lecturing is going on for a while, and you have been involved since the beginning, I am assuming. So can you give us some information about that?
Yes, I'd be happy to. The Armenian Heritage Cruise, as many of you know, has been operational for about 21 years. Every January there's a cruise to the Caribbean. But very recently, we have added a medical program. And the medical program
How many years now?
Well, the medical program started about 5 years ago, but it's been growing slowly, such that this coming January in 2018, we will have a faculty of 5 physicians, dentists, pharmacists, covering a broad array of medical, dental, pharmacy topics. Right. And by the way, this is medical education credits.
Yes.
There are pharmacy credits and dentistry credits. So
how many credits do they get
for
this program this year?
It's actually 10.5 hours.
All registered credits.
Of registered credits. And for most of us, we need about 22 credits in a year. So this will...
In my family medicine, 50 credits. But
that many. Well, anyway, it's a substantial amount of credits. And in addition, there will be over 1,000 Armenians on this cruise ship, and there are a lot of other cultural activities. So there isn't, but the medical side is what I'm responsible for, and you know, I think it's going to be first rate.
So there are some professionals in medical division or so, but I'm sure some other people, general public, are attending too, possibly.
Yes, and
they can attend?
Yes. So this will be dependent on how many actually register for the medical and dental credits. And what I hope is that the room will be large enough.
So we would like really people to register beforehand.
Yeah, that's right.
And we're going to give information during the program where to call and how to register.
That's right.
So it's important because of the arrangements of the rooms.
That's right. Yeah. Now, if it turns out that the registrants fill the room, we have decided to have an extra session for those who do not need credit. They're interested in medical or dental or pharmacy issues, and they will we'll have a special session for them, like an auditing session.
Sounds really good.
Yeah.
So if there's a place, they can attend, but if there's no place, maybe a second session.
We'll make room.
General public.
Yeah.
I'm talking about Armenians, obviously.
That's right.
Hopefully
That's right.
Attend. Yes.
Yeah, this is only for Armenians, by the way.
Yeah.
The boat, our cultural activities, the medical activities, it's only open to those who register through the Armenian Heritage Cruise.
Okay. So let's go over who is going to be speaker in this medical education program. Let's talk about those people.
Yeah. So we have a faculty of 5, and of course I'm a faculty, and my specialty is osteoporosis. But each of the faculty will spend their first of their 2 presentations on the work that they are doing in Armenia. So Larry Nigerian, for example, and all the great work that AAHPO has done, the medical missions, Larry will talk about that. He'll focus on ophthalmology because that's what his specialty is, but he will do that. But in addition, beyond the mission to Armenia relative to what AAHPO is doing and what ophthalmology is involved in, he will talk about eye care throughout the world. Now, another faculty member is Sam Badalian. Sam Badalian is head of urogynecology at St. Joseph's Hospital, which is part of the State University of New York, Syracuse, upstate system. Sam graduated from Yerevan State Medical University, actually.
So then he knows the Yerevan.
He knows Yerevan, and he has had an illustrious career here. And he will be talking about women's health with specific regard to issues related to urogynecology. oncology.
And as well as you'll be talking about what he's doing in Armenia in terms of urogynecology.
That's right.
And who else is in the
Well, we also have Greg Kazanjian. Greg Kazanjian is a DDS, a dentist.
Right.
He's on the faculty of NYU, and Greg is a world expert in periodontal disease. Okay. He's particularly interested in the health implications of people who don't have good dental hygiene. Exactly. So Greg, and also, again, like the rest of us, has been doing work in Armenia.
You better go and listen to him, because there was a recent study showing that dental hygiene is so important. Sometimes cancer even originates from that dental hygiene.
Yeah, and he's also going to talk about beyond cancer, which is, of course, very important.
Right.
If your dental hygiene is not good, your health is not good.
Exactly.
And Greg, that's been one of the things that Greg has been doing. So, and then our fifth faculty member is a pharmacist. His name is Romik Eskandarian from Glendale, California. There are a few Armenians in Glendale, California.
All over America, actually, are coming. Okay.
So those are our five faculty. They are first-rate faculty. There will be time for Q&A, interaction with us throughout the whole cruise. So it's something that, for those of you who like cruises, like to be with our fellows and our Armenian friends and colleagues, and also get credit at the same time for your medical and dental.
Now, really, what I understand is that it's very important that they call and register beforehand.
That's correct.
The room availability or seat availability is so important.
That's right.
Let's talk about now. I know you're very much involved in Armenia and taking DEXA missions to Armenia.
Yeah.
And I know there's an event coming in October.
Yes.
Let's talk about that.
Yeah, I'd love to talk to you about that.
Yes.
This is something I've been working on for 10 years.
Right.
When I first went to Armenia, literally 10 years ago, and I've been going back every year at least once. And my goal, and I think we have reached our goal, will come this October, when we will have the grand opening of the Osteoporosis Center of Armenia. We have a full-time director, Dr. Varta Babalyan. She's working right now on the center.
Yeah.
We have rented a wonderful office, and we're going to have a grand opening. But over the past 10 years, what I've been able to do is bring DEXA machines. DEXA machines are bone density instruments that are very safe, very easily used, and can give with great accuracy the state of a woman or a man's skeleton.
Diagnosis of osteoporosis.
The way you diagnose osteoporosis. Right. So every year, now 10 years later, we have brought 10 DEXA machines. And they have been placed not just in Yerevan, but we have a machine in Gumri, we have a machine in Vanadzor, we have a machine in Karabakh, in Kapan, and we place the machines and we train the radiologists who do DEXA testing in Armenia. So the capability to measure bone density in Armenia now is over average when you consider other countries in the world. So we've gone from the last place in terms of the world's countries of capability to do bone density testing to now being well above average.
Before the program, that the opening session,
yes,
this October 11th, besides it's going to be the opening, but there is a lecture series coming for other physicians or our health professionals.
Yes, this is what another feature of my visits, and that is to have an osteoporosis conference. And this coming October, we will have our 11th annual osteoporosis symposium that covers anything you can imagine related to skeletal health.
Right.
And we have a faculty of outstanding people, both from the United States and now from Armenia, who have been trained.
And
they're now able to serve as faculty.
Right.
Last year, and this year also, but we have the program at the American University of Armenia, and those of you who are familiar with the AUA know how big the main hall is. It holds about somewhere between 800 and 1,000 people. And last October, we had over 600 people, not all physicians, but there were nurses, pharmacists, healthcare professionals coming. And so this year, for the first time, we're going to have a bone density training course. And what we're doing for that is to take the centers that have DEXA instrumentation, and the radiologists are going to come from all over Armenia, in addition to which, this has now become international. We have countries from Eastern Europe,
Eastern Europe, you said, yes.
We have countries from Russian-speaking countries.
Some from Russia too, possibly?
Russia also.
Yes.
And we now already have over 60 people who are doing DEXA in that part of the world. And what I like to think about is that Armenia could become the center of skeletal health, in the whole Eurasia area.
That'd be beautiful.
And just to think that we, this tiny country, could become the best. And that's my goal.
Dr. Bilezikian, thank you. So we're going to be talking about osteoporosis and treatment in next program.
Thank you.
We conclude with Dr. John Bilezikian today, and next program will be osteoporosis with John Bilezikian. Good health is precious and priceless. Keep up to date visiting by AAHPO's website, aahpo.org. I'm Dr. Ohan Karatoprak. Until next program, so long.